Last of the topics is something we call trimodal therapy. That is going to be something that you hear about coming up. Um, we um, we covered it last week. Trimodal therapy is the use when patients used to come in 6 weeks ago. Their lungs were generally flooded with fluid. They had high fever. We had to get them into the ICU. We had to intubate them and then put them on, some sort of broad spectrum, whatever, to prevent their lungs from turning into a petri dish and then going into sepsis and all this other crap. That's the only thing we knew how to do then. Now, 6 weeks later, now 7 weeks later, we know that this is an inflammatory disease. This is an immune modulation disease. This is a coagulation disorder, and this is has a viral etiology. So what we're trying to do is form up a strategy before we can get therapies down to a protocol for every patient across the country. They'll all get this if they're COVID. Right now, we're experimenting with a trimodal therapy. One is anticoagulant. Number two is to add a immune modulator. And then the third one is to use an HIV, not necessarily an HIV, but from the world of HIV, an antiviral that has a strong efficacy against viral replication and propagation. Why is this important for you to know? I don't know that it is, but unfortunately, I see a lot of patients, a lot of friends and family go into a medical environment. And like I said, not everybody is practicing at a standard of care. That mountain of up and of, really diligent, latest information at the university medical center level, is not available to everybody. You may end up in a community hospital, and they just don't have the resources. But maybe if you're armed with the resources to say, listen, I know that this is happening at Mount Sinai and at blah, 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 and UPMC. And I know from, attending these lectures that, and again, I'm trying to be as credible as possible. I don't give you information that is unvetted and, that it's just junk science. I don't even tell you everything that I just learned, because I want to make sure that it has some validity. But it's good to have that in your mind, in your family's mind, that this is a disease that requires anticoagulation. It's a disease that requires an antiviral, and it's a disease that requires immune modulation. Okay. So if you show up at your hospital and the doc is pushing hydroxychloroquine, ask for a second opinion quick. All right. This is the only reason I'm telling you about this. So yeah, this is what we're really, really trying to figure out. What is the best immune modulator to give? What is the best antiviral to give? And what is the best anticoagulant? And this changes by stage of disease. If you come in early enough and we have you immune modulated before the cytokine storm begins, we have you anticoagulated, so we protect your kidneys and your lungs and your other organs. Then what happens to you as the disease progresses is minimized, and what happens to you after you recover is the best possible outcome. Okay, this is what we're trying to figure out, and I think by the time John and I finish these weekly events in a couple of weeks, I will have information on what we think is going to be the protocol that has the greatest results so far, best outcomes for patients. And sometimes it's especially in these situations when the science is so new, it's good for you to be armed with it and know what to ask of your doctors when you get there, if you get there, which I hope you never get there.